Hi, everyone. Thanks for joining us. We're here to discuss all things Bexar County Jail, and we have a really exceptional guest today. His name is Dr. Alex Testa, and he's with University of Texas Health Science Center, Houston. He's based out of San Antonio, but he's with the Health Science Center in Houston. And Dr. Testa had done an 18-month evaluation of the jail. That includes his writing time, of course. And he produced a report earlier this year that lays out a lot of what I'm just going to candidly call challenges at the jail. It's fairly critical. A lot of praise for the staff and for the access that he was given, 24/7 access at the jail. But I don't think, Dr. Testa, that you pulled any punches in this report. And we're here to talk about it because I think it's in the public's interest, to be aware of some of the dynamics and challenges that are happening that perhaps are contributing to many of the issues that we're seeing in the news in the jail. And, I don't know if we can point from one thing in the report to jail deaths or not, but I think there are a lot of kind of procedural, structural, spatial issues. Like I was astounded when I read this report, to be honest. So thanks for being here.
Yeah, thank you for having me. Looking forward to talking.
Yeah. So for, I think I don't know how much public awareness there really is about the Bexar County Jail, to be honest. I do think there's some awareness about the high number of deaths there. And sometimes we see news stories where, inmates are released by accident. But I think your report in many ways presents to me, and maybe you disagree, so feel free to disagree. I don't want to put words in your mouth, but it presented to me a jail that is in some ways in crisis. It's in a crisis almost from, as I perceived it from the get-go, that it was surprising for me to read about that. In your research, there's no clear system, in terms of people come into the jail. There's no kind of you go to point A, point B, point C, point D. There's no, there might be an idea of having that happen, but it sounds like in reality, it's kind of mixed match in terms of how people come in, that it's this paper-based system that people are kind of wandering around the open booking area and calling out names we're ready for you now. So talk to us about maybe let's just big picture, 10,000 foot level. What would be the three big issues that you see at the jail right now?
Sure. So yeah, I first hit on something you said. I think that a lot of people don't think regularly about the jail, especially until maybe they know somebody like a friend or family member who've been arrested, or maybe they've been arrested themselves. Until somebody gets into the process or feels the process, that might often be one of the first times that they really kind of think about what's happening, and then maybe start to take issue with the fact that, hey, I want the system to be maybe more optimized. And so that was really what I was commissioned to do, to come in as an outside researcher and expert to kind of look holistically at the processing of individuals that Bexar County had hired me on for, and to provide a set of recommendations for identifying areas where the process was not optimal, not working smoothly, had challenges, and trying to provide an array of potential ways to better optimize it. And so to your point, asking for some of the kind of big issues there. So the report kind of identified a variety of things, and if people are bored and want to read a 100-page technical report on the jail,
I've read it 5 times. So
yeah, it's a page turner. So I would encourage them to do so and to take
here it is, people.
Take interest in it. It's up online, free to access. But the report definitely does identify a couple key issues. So I'll hit on 3 of the big ones, but we can definitely dive into other ones. So one, what you said, is kind of an unoptimal flow of individuals into the facility. I think what listeners need to understand is, from the moment that someone gets arrested, that is the start of a process through the criminal justice system, right? And what happens here in Bexar County is typically after you get arrested, you are transported transitioned to a processing facility by the police officer who was the arresting officer. And that facility is called the Justice Intake and Assessment Annex, located downtown.
Built in 2018.
Built in 2018.
That's important. We'll talk about that in a minute, but that's very important, I think.
Built in 2018, yep. And from the moment you get there, you go through a number of stages of processing. You're, screened for safety, you receive medical assessments, you talk to pretrial detention officers to understand your bond status, you potentially talk to a mental health specialist, you do a lot of sitting and waiting, you are eventually seen by a judicial magistrate to determine your bond status, and one way or another, you eventually finish that process. We can dive more deeply into the details where you'll either end up going to the jail or you'll being released back into the community.
And that process takes 12 to 16 hours on its own.
Yes. And so that process typically takes 12 to 16 hours. So as I mentioned, from the moment you get arrested, you're in for a long road, and that includes the processing and then everything that comes after that. And so to get into kind of some of the challenges, one of the challenges is really trying to streamline that process, right? I think that there's a recognition that from the moment that somebody's arrested, it's going to be a complicated path there, but also an arrest is not a conviction. It just means simply that you're accused of doing something wrong, and that we don't want to hold people for extended periods of time when they're simply being accused of something. And so there's, the way that the facility has been set up, there's a number of steps that you need to go through in order to progress and eventually be released from the facility. But as you noted, as the report kind of found, that stage is definitely not as efficient as it needs to be. And that, if lack of efficiency, what my report found was really kind of due to a couple main challenges. So one is the lack of an integrated kind of data system that tracks people's flow. It does utilize a kind of antiquated system, which is very paper-based tracking system, meaning that often as you go from one stage to another, there's a lot of paperwork. Sometimes that paperwork is physical paper that's passed from one to an agency to another. Sometimes that paperwork is uploaded to kind of a centralized share system, but again, it's not like highly efficient kind of database, but that makes like the tracking of individuals very challenging. So often we don't know, when somebody has completed one step and their, like queue is ready to go to the next step. There can often be people getting kind of lost for some period and maybe sitting around for minutes or hours, many minutes or hours extra until another, organization or agency within the facility is ready to, pick them up and continue their processing.
When you say lost, it's like nobody actually knows. I mean, they're in the facility. They're in that open booking area. But and for those who are just watching and we haven't shown like B-roll per se, it's like you're at the DMV in some ways. It's like all these open seats and there are TVs and they're just sitting there. And so your report, like, are there literally like staff at the jail wandering around saying like, Testa, it's time to get your health screening or whatever. Like, is that, because that's what it sounds like here. It's, the current system's reliance on manual tracking requires staff to physically search for and verbally call out names of detainees to verify their location and status within the facility.
Yeah, that is a common approach, again, because there's, at times there can be well over 100 people, dozens, 100 people in this facility waiting in a very open booking area. And so when somebody progresses and, you work for your university health system and does the medical screening on Bexar County pretrial, and you finish your medical screening and they're going to go to me next, it becomes a logistical question of, okay, how does this person get transmitted to me? And often what happens is they get transmitted to an open booking area. I eventually get a packet that says, John Smith is next up for me to to see, and I need to go find John Smith amongst this sea of hundreds of people. And so I go start shouting John Smith's name, and hopefully he answers. Hopefully he hears me. He's not asleep, or maybe was taken to another segment of the facility for different type of processing. And that is what I was getting at with that very kind of manual nature of finding people. And as you can imagine, that could result in, again, like I said, John Smith may be in the bathroom. He may have been taken back to meet with a lawyer and not hearing me. And so it could really draw that process out.
Could it contribute to the wrong person being released? Or could it contribute also to someone's medical emergency not getting noticed if they're in that open booking area? I mean,
Sure.
Feel free to say no. I don't want to put words in your mouth.
So I'll touch on both of those. I think, and the medical, I would have more concern with. The wrong person getting released, I think anytime you don't have a really fine-tuned integrated database that confirms, a person has touched upon all the steps of the process, clearly outlines what the decision was at all the steps of the process, that could theoretically lead to the wrong person getting released. I think the facilities put on a number of back-end checks to try to minimize that, but really to optimize that, you'd want, a really good data system that tracks people. The medical for me is the bigger concern, that people kind of medically decompensating over time when they're in there for an extended period of time, if they're withdrawing for substance use, that if they have a medical condition, even if they're just in poor health and being in a environment for 12 to 16 hours, sitting on a medical bench, not having somewhere comfortable, they are fed and give water, but, depending on their medical condition, you could imagine someone decompensating medically in a fairly quick manner. And so to me, that's the larger concern of needing to move people through efficiently.
So part of the issue is this technical dynamic of the jail needs a database system that's just like electronic tracking of you've come in, you're here, and this is where you're at in the system as you progress along, right? But some of it's also like the physical space, right? It is. So, and that's where I said it's important to talk about. It was built in 2018. This intakes annex of this intake center to the jail is new. They spent millions of dollars on it, but my understanding is it's too small and it's not designed in a way that you could actually I guess sequentially flow people. Is that
Yeah. So absolutely.
It's so new. It's basically brand new.
It is. Yeah. 2018 was not that long ago. So yeah, I think the flow process is largely driven by two issues. So one, as we talked about, was the data management system that can have a way to track a person through and communicate to all the different agencies that work in a facility of what's happening. The second is the physical structure. So if I need to go through 6 stages, from entry to release, ideally a building is in a way where those 6 stages are kind of one next to each other. So I go from A, then I move down the hall to B, down the hall to C, to D, to E, to F. I think that would, in theory, do a couple of things. It's easier to track people. A, now they're in section B, now they're in section C. This, you can see where people are in the process. It's harder to lose track of people where someone gets, bogged down in a certain stage for a while. The facility, though, is not built in that way. So often when people move from one stage of processing to the next, they might move all the way across the building and then across. It's a very zigzag format. And I'll just say briefly that while they're waiting for the next stage of processing, they're held in a general open booking area. So everybody, basically regardless of if they arrived 30 minutes ago or they arrived 14 hours ago, are sitting amongst the same sea of people. And so again, that can make it very hard if you're just visualizing where somebody is in the process, where they need to go next. And that flow, that physical design of it, I think makes it complicated to kind of optimize that flow.
Yeah, it almost seems like, again, I'll try to paint a visual for folks who hopefully haven't been there. It's like the open booking area, again, is like this DMV seating area, and it's like a hub and, it strikes me as like a hub and spoke system. Like you're sitting there, you get pulled for something, you go back to it, and then when you're sitting on these seats with the TVs around, then there are these cells on the walls for people who would be in like they could be dangerous or disruptive, right? Mm-hmm. But again, most of the inmates are going in and out of this larger seating area, right?
Yes, that's a great analogy of it. So they're going in and out of that rather than some kind of more logical, like sequential flow of a straight line or a square or something where you could track that in some way.
Yeah, you'd know where. Okay, this is where this person came in at this time, and this is where they're at now. And I think it would also create a way for them to study how long is it taking for people to be processed, right? Because the longer, all the studies say to me that the longer you're in jail, whether you're in the open, whether you're just being processed up front, you're getting released on bail, or you're stuck there pre-trial, the longer you're there, the worse the outcomes are usually.
That's what the research says, that you want to optimally move people through, no matter what stage of processing is. If it's you're sitting in jail, an overnight facility, or you're going through a pre-trial processing, booking process, moving people through as quickly as possible is associated with more optimal outcomes.
And that's super important to me because, well, it's important for the outcome first, but it's critical here because there's a huge part of what we'll just call the jail processing system that isn't in your report, which is most of the people arrested actually started at a city facility, which you weren't able to access, right? So this is what in news world we've called double magistration. It seems to me to be very unique to San Antonio. And my view is that it's really a power struggle at this point between the city and the county. That's not something to be studied. That's just my own kind of outside perception, right or wrong. But like for people who are listening, watching, why don't you explain this added layer of time and processing, and I guess I would say confusion probably for the defendants and their families, sure. Right? So
yeah, it's great. And yeah, if I was going to hit on some of the top 3 challenges, probably number 2 would be
all right.
the double magistration challenge.
I jumped ahead. We only got to,
and it's related to what we were just talking about. So all these things are they're not even distinct, mutually exclusive things. They're all tied together in some way, but. Yeah, the double or dual magistration process essentially, again, is the following. At the Justice Intake Assessment Annex facility, one of the big parts of the processing is that you go in front of a judicial magistrate who essentially kind of determines, your disposition. What is your level of bail or bond going to be to get out of the facility? Are you eligible? Would they grant you a personal recognizance bond, meaning that you could leave without posting money just on your own personal recognizance because maybe you committed a low-level offense, you're trusted to come back, or in case maybe you're exceptionally dangerous, should you be detained in the jail, without a bond until an upcoming hearing or trial. And so that is the big step that determines really if you're going to get out and how of that facility and re-enter the public. The dual or double magistration process is that when somebody is arrested by the San Antonio Police Department, which makes up over half of the arrest in the county, they first go to they don't come directly to the Justice Intake Assessment Annex. They first go to a city facility where they are processed, and they go in front of a city magistrate who, performs a hearing on them. And then eventually they are put into a transport van. And at pre-negotiated times of the day, they are transferred to the Justice Intake Assessment Annex. They then enter there and they start the entire processing that we were talking about again. And it's called double magistration because they then go in front of a county magistrate and get the same processing. So they have gone in front of a judicial magistrate twice.
Yes.
And the time at the city facility, careful how I say this, but like it doesn't really, I guess it doesn't like count toward their ultimate disposition, because everything that really decides how they're, what happens to the individual and if they're ultimately released is the processing at the county facility. And so the arguments of it is that that there's an inefficiency in doing all of these processes 2 times.
Yeah, it seems redundant. And I think your study says it's roughly 4 hours, you think, of additional time, but the clock doesn't actually start for them until they're in the county facility, right? So the official clock, I guess.
Yeah, there's some estimates based on looking at the time when an arrest would have happened from an SAPD officer to the time when they would have got to the county facility. And so typically 4 to 6 hours on average is when you might see somebody at a city facility before they're transferred to the county facility.
And we'll get into this in a second. Like the city has its reasons. Sallyport's too small. They want to kind of control the flow of people. So they have concerns about the amount of space in the open booking area, and so we'll talk about the merits of those concerns. But I mean, kind of like to me, the $1 million question is: does anything meaningful happen in that first round of processing? Like, is there any? Because it seems like it's all or nearly all of it is duplicated. So like a judge sets a bond, but then that bond can be changed, I would assume. Mm-hmm. So is anything happening in terms of from a processing standpoint at the city that is meaningful?
I'm not aware of.
I guess you don't know.
I'm not aware of anything, and full disclosure, I have not seen the city processing facility.
You requested though, right?
I requested. We went up the chain of command to be able to see the facility. It was not permitted to go into the facility. It's not a place you can just walk into. Right. You do need, permission and escorting. So, because I haven't seen the process, I can't definitively say. I mean, for all I know, if I saw the process, I'd say this is way more efficient, and we should turn everything over to this stage. But I don't know. I haven't seen it. But what I can say is, under the current system, because of all the stages of processing that happen at the Justice Intake and Assessment Annex facility, and that it is the county magistrate's decision that ultimately, dictates what happens to an individual. There's nothing that I saw that happens at that facility that influences or speeds up the process or kind of changes anything in terms of the ultimate outcome.
See, this is where it's like, just from an observer, like my head kind of explodes, because it's that statement to me, then it gets into like, is this good governance? And if you care about like resources, if you care about time, if you care, you could be a lock them up and throw away the key type of person. I don't see how anybody could objectively say like, oh, this is good. Like that, like having 2 rounds of magistration benefits the public in any type of way. And then I think to a point that you made earlier at the very beginning, just in our introductory point of discussion, people in jail are largely difficult, and probably the vast majority of them are guilty ultimately of whatever they've been accused of. But everyone is entitled to the presumption of innocence. Sure. So they go in there with the presumption of innocence. And I think for a lot of people, at the end of the day, we're talking about this may be like the closest encounter a lot of families have with the government, to be honest, that, it could be your niece, your nephew, your mom, your stepdad. So it ends up touching a lot of people who maybe would be indifferent to the jail. And so that's like my big wind up to do you believe that this dual magistration redundancy, does it create strain and stress on the defendants and their families as they're trying to navigate a pretty complicated system to begin with? Sure.
I think in the work I did, there was some areas of identification where it does. So definitely one of the areas is a challenge on the family. Someone's become arrested, and you become aware again that a family member has become arrested. You don't immediately know where they are. There's a lot of sense of panic often. You want to find the person, you want to get in touch with them, you want to help them get out of there. And so the literal, movement of an individual between one facility and another creates, I think, strain or challenges among people to actually find somebody. There's regularly people calling, for instance, the county facility, looking for somebody, saying, hey, this is this person's name. They've been arrested. Can you help me identify? Are they there? Where are they? What can I do? And a lot of times people say, like, they're not here, right? Because they're, at the city facility, and right, and they might be told, to call a city facility, try to find them there, and then the person might call the city facility, be talking. Eventually, then they're transferred over, right? So there's this movement of a person, like, between facilities that, for the family members, people trying to keep track of them in this moment of potential panic and strain, trying to, like, figure out what to do. Where should I go? How can I help? Right? That's again, like, not completely optimal. For the person themselves, again, being arrested is a highly stressful experience, especially if someone's first time. They don't know what to expect. There's people this has happened multiple times, and they kind of understand the run of show and how long they're going to be in there for. But something also that's important is keeping people informed about what's happening to them and what stages of processing they're at. And so again, this is also stressful in that it's adding quite a bit of time. Like I said, about 4 to 6 hours on average, which people can equivocate whether that's a lot of time or not. But if someone ever sat in that facility and I told you have to be here for an extra 6 hours or something, I think that would be viewed as pretty stressful, because it's not the best place, most comfortable environment to be in for an extended period of time. And then all those things are, again, potentially exacerbated if you're somebody who has mental health conditions, if you have kind of substance use condition, you're detoxing, you have a medical condition, additional hours, that you're somewhere, or that even you're being transported from one facility to another, and they do send over paperwork, but whether, how well communicated those conditions are, if they are detected in one facility to another, those things start to create challenges. They start to open up, doors where problems can start emerging, and people can start experiencing medical episodes.
Yeah, so I think obviously a researcher would have to really look specifically on if there's any connection between the magistration and some of the detox deaths at the jail, right? But I think it's definitely well within the realm of a question of, and it's not for you to answer right here on. Yeah. This is just a point of discussion, or as I think about it, it's a question I think officials probably need to explore. Of, does this contribute in any way to the pretty high mortality rates in the jail? And I don't know. I don't know the answer to that, but I think it becomes an imperative probably as people look at the system. So, I know that from the city perspective, Sallyport is an issue. Mm-hmm. Property storage is an issue, I believe. Wanting to control the flow of people is a certain dynamic. This gets back to the intake center at the jail was built in 2018. These issues were discussed then, and obviously, the intake center was built regardless. So, are those kind of like spatial issues, structural issues? Are they fixable at the intake center? Like is this, if the Sallyport is too small, the Sallyport's too small,
yeah.
Right?
Yeah, I think, I just moved to San Antonio in 2018, so yeah. Full disclosure, I wasn't involved in the earlier processes, but I would say that one thing that I do hear from people, and I agree with, is the physical structure wish that the facility was built bigger. I think, as we all know, San Antonio is growing rapidly, and it's also really especially taken off in population growth since the mid-2010s. And so I think when that facility was designed, there was very likely a view of building the facility to meet today's demands. A number of things happened after that facility. You had the COVID pandemic, which impacted it a lot. You had a huge spike in crime that was seen nationally, but also in San Antonio. You had massive population growth to this area. And so, as we were talking about before with the size of the facility, I think there is agreement that the facility was built smaller than what they wanted. If they could go back today and redesign it, I think you'd get nearly unanimous, consensus of, okay, we're going to make this bigger. We're going to make the physical structure of it different. Now, to the challenges, one thing I will definitely say, and I will, highly compliment the facility, is that the personnel who work there are highly innovative and strategic at working with the space that they are given. There are constantly changes being made, tweaks being made, attempts to pilot and try new things. Okay, let's move this over here. Let's move this station over there. Let's try to and they're limited with the actual physical flow of things. They also do renovations on the building. They knock down walls and they try to. Again, there's limits. It's a concrete, building, as it has to meet jail standards. This isn't like sheetrock that you're dealing with that are separating things. It's thick concrete, so you can't just knock down walls that easily. But to the point of, can these things be remedied? I think that there's absolutely opportunities to do this, and to me, one of the things really is to follow kind of the structure of what they're doing, is to pilot new things, right? Take, nothing necessarily stopping people, to my knowledge, from taking a couple days of the week, one day a week, and bringing everybody to one facility and seeing what happens. Right? It will tell you pretty quickly if the Sally Port, which is the kind of secure garage where police drop off or bring in detainees, is too small. It would tell you if the physical structure is too small to hold the flow of drop-offs. It would tell you if the having the city come on a pace as they arrest people, rather than process them at the city facility and bring them in batches to the facility, disrupts the flow, or causes police officers to be at the GIA facility for too long and then not out on the street quick enough. Those are concerns that have been raised, and until we, again, as a researcher, until we test these assumptions, they're just claims that one side is going to say this is a problem, the other side is going to say this is not a problem. And my standpoint, again, as an outside researcher, is we can test these assumptions and see, if they're true, if they're false, if some are true and some are false, and then also if there's a remedy to them. If we encounter that, yes, one of these things is true, the flow is disruptive. Well, is there a way to amend the flow so that it's not disruptive?
Yeah, there's no way to know until you start trying, because instead it's just a circular dialogue. So, high level issues we started out with, talk about 3. We've done 2, right? We've done the kind of the cluster, when people enter the actual jail, and then a different type of cluster with dual magistration. So for you, the third super important high level takeaway of this, which is fascinating. I know you said it's dry. It's not. It's kind of jaw dropping. But
thank you.
So, what's number 3?
Number 3, I would put in the basket of kind of mental health, substance use, intellectual developmental disability screening, and diversion. And this is something that I think has been discussed both here in the county for a while, but also in a number of other counties and a number of areas of Texas where there has been things done about it. And often that has led to diversion programs, diversion centers, which we'll dive into.
Yeah, so the creation of a diversion center.
Yep.
And so if I understand this correctly, it would be a separate facility. So these defendants would they even be, well, you explain to me maybe the nuts and bolts of they even get processed at the jail, but it takes them out of the jail setting, right? And they're immediately into kind of like a triage type of setting where they're being monitored and receiving mental health or substance abuse care. And these are low level offenses that they're accused of, right?
Yeah. So
it could even be traffic tickets, right?
Sure, absolutely. So the idea of a diversion center is essentially the following. It is a distinct center, a distinct physical structure to process or handle a subset of the population, and specifically that's identifying people who have come into contact with the criminal justice system, but are kind of deemed where the criminal justice system is not the optimal place to handle them. So often these are low-level nonviolent offenses because
trespassing, vandalism.
Yep.
I know vandalism. Yeah. If your property's been vandalized, it's not low level, but these are like nuisance offenses.
They're often low level things. These are not assaults and or even serious property crimes where somebody has stolen thousands and thousands of dollars of materials. So that's the first thing to understand. Second thing is that they're often also looking, these facilities aren't just looking for low-level offenses. There's a way to handle and process low-level offenses quicker and more efficiently, but they're looking for people with a condition, often mental health, substance use, or intellectual developmental disability that requires specialized treatment, which the jail and the criminal justice system is not, adequate to deliver, right? The reason we built jails were not to become mental health treatment facilities. They are facilities to process and detain people who have committed criminal offenses and pose some danger to the public safety. And so the idea is often there are people coming into contact with, who are arrested and they have mental health conditions, they have some of these other conditions, and they would very much benefit for treatment. And the lack of treatment might exacerbate and worsen their status. And so what a diversion center says is that if we can identify these individuals as they're being processed at some stage through the criminal justice system following an arrest, can we take them out of this traditional criminal justice processing and divert them to an alternative path that the focal standpoint is the delivery of treatment rather than delivery of punishment? And when can that happen in the processing? That could happen at, ideally at various stages of the processing. So often these centers kind of work on what's kind of been characterized as two things, deflection or diversion. So deflection is an opportunity from at the moment of arrest. If a police officer deems, hey, I just picked this person up for trespassing. I'm not a mental health expert, but this person has clear mental health.
Something's off.
Needs, ran a criminal background check, they don't have a violent history, they don't have anything. Instead of bringing them to the processing facility, there's now an alternative facility where I can bring them to, have them evaluated there, see if they're, a good fit, have a thorough criminal history record done. Again, if we get them there and they find out, hey, this person's, wanted for attempted murder, you can easily deflect them back to the other facility. Right. But now they're brought to a facility where, okay, hey, yes, this person doesn't have a violent history. A trained clinician has now evaluated them, screened them. Yes, they seem to have mental health needs. Okay, let's leave them here, or it can be an inpatient facility, and we can get them into a treatment program where we can start delivering counseling. We can start on a medication regimen that might help them. Right. The other process is what's often referred to as diversion, which is you go to the Justice Intake and Assessment Annex and you start the processing. But as part of that processing, we have a mental health professional deliver, screening assessment for, mental health needs, intellectual developmental disabilities, suicidal risk. And if it's detected by a mental health professional, there's an opportunity again now to divert that person from the traditional path and say, okay, hey, this person, go and start working with the staff, with the district attorney, with the county sheriff's office to say, we've identified this person. We think that this person, in our professional opinion, will benefit more from treatment that we don't have the resources of delivering here. We have a diversion facility that is, and then finding out, can we divert this person? Again, taking a look at what they've been arrested for, their criminal history, et cetera. And then if deemed this is a good candidate for diversion, we take them out of that process and we bring them over to a separate facility. And this is something that either is implemented or is being implemented in every other major county in Texas. So Harris County, Dallas County, Tarrant County, Travis County, all either have a facility of this nature or are actively building and about to implement a facility.
Right, and we don't. Obviously, we don't. We're having discussions now about it. But I mean, what you're describing is basically incorporating a number of off-ramps for people. And if we're going through the process. So I guess if we took it a couple steps back, if there were a data tracker and a truly sequential process, there would be off-ramps at different points. In your research in this report, did you find that there were adequate staff levels to do the assessments? And I guess at the moment, even if there are adequate number of staffers to do these types of assessments, there's no place to divert anyone to, right? So
the diversion as it currently exists faces at least two major challenges, if not many more. But so one of them is the lack of a centralized diversion facility. So currently, the county does try to divert in a way. But the problem is that when somebody is identified as, okay, this person has clear mental health treatment needs, again, they're good candidate for diversion. They just were picked up for a very low level offense. They really do not need to be spending time in the jail right now. The question is, what do we do with them? Where do we send them? Right. And it's, currently is more of a hodgepodge of different community organizations who may or may not have availability of resources or be able to take this person, or depending on, again, this is a 24/7 facility. So again, depending on the time of the day, can I even get in touch with somebody at this organization right now? Depending on the organization's own staffing levels. And so there needs to be a clear, place to divert people if you want diversion to happen. That really does require a centralized, diversion facility that is well staffed. The second challenge is part of the processing. Diversion, where it is successful, and I would point to Harris County, Houston, as a place where it has been going on for nearly a decade now. It has been very successful and has been bought into the system. It requires adequate staffing and adequate training around it. So you need universal screening and assessments to be done as part of the process. Everybody who comes in needs to see a mental health professional who can deliver, an assessment and have some time with the person and kind of determine their status and make a professional judgment on them. It also needs, again, buy-in and training, including from law enforcement, to be part of this. And so all the organizations and entities who touch on this need to be bought in. But it also requires, what we touched on is adequate staffing, right? And while it's a very fluid situation. Staffing is kind of hard to talk to because it's a fluid situation. Mm-hmm. If we take we can take a point in time snapshot of the staffing of all the organizations that work in the facility, and we can get an idea of, are people understaffed? Are they adequately staffed? But I think one of the hard things to really understand staffing is it's so fluid. Almost all of the organizations there face a lot of turnover. And to me, that's kind of been one of the bigger problems, is that there's a constant ebb and flow for people between we're at or near our adequate staffing levels, mm-hmm. and now we're below it, and we're at it and we're below it. And then the second problem with that turnover is is the loss of, people who have institutional knowledge and training
Right.
on the process, that you can be on paper at adequate staffing levels, but if you just got there because 25% of your staff was hired on 4 weeks ago, you're not really at adequate staffing levels because a quarter of your staff doesn't fully know
Right.
what's going on. And there is absolutely challenges with that kind of employee turnover and hiring, which is due to a lot of factors. I think if you've spent time in that facility, you would understand probably why people don't stay
Right.
very long.
It's a pretty unpleasant place. I mean, obviously jail shouldn't be pleasant, but it's yeah. Are you aware of, is there any assessment of potential for detox? Like detox, it seems to me like when I reviewed the deaths in the jail, a lot of they fall into kind of three groups. Three large groups. There's inmates who die by hanging. There's I guess that suicide would be part of that. But then there's another group. So I guess it's really two groups now I think about it. But there's another group. They've basically detoxed, and I'll read report after report where they have a heart issue, or a lot of times they'll be vomiting and then they'll fall out of their bed and they'll hit their head and they'll, these are all symptoms of detoxing. And so I'm just wondering if there's a physical health stat like assessment, right? There's a medical assessment. There's a questionnaire about potential for mental health issues and suicidality. Are you aware of any assessment regarding potential for dangers associated with detoxing?
Sure. So yeah, I think detoxing is a huge challenge there. So when you are brought into the facility, really almost immediate, the very first thing that happens to you is a safety and property check. So you go through a body scanner, you make sure that you don't have any weapons or drugs on you or inside your body. Any of your property that you came in with is taken and put into property storage. But the next immediate thing happens to you is a physical medical health examination to check to see if people are medically stable and do kind of a medical history on them. If somebody is determined to be not medically stable, they are emergency diverted, meaning that they're taken to one of the local hospitals to emergency room and said this person's not in a physical condition where they're able to sustain 12 to 16 hours in this facility.
Right.
And so there's a check there extremely early in the process. I mean, within usually 10 to 15 minutes of your arrival, that you're getting that medical assessment. Now, the detoxing component of that is challenging. Why is it challenging? So it, to some degree, can come up on that physical medical examination, especially if you're already in the stages of detoxing at that process. But I think one of the challenges is that you can miss if somebody's, maybe currently on drugs, or they're not on drugs and they're not yet showing detoxification symptoms, but they will be in an hour, 4 hours, 8 hours, something like that. And, people might not be willing to divulge at that point their drug use or something like that. As you might understand, I've just been arrested and now I'm sitting down with you and say, I'm going to need heroin in 4 hours. Okay. That's probably, you can understand why someone might not bring that up at that stage. And so the detox, I think, does become a major challenge because, like I said, you're going to be going through processing for a pretty long period of time. You're going to be getting medical examination early on. There are medical staff on site later on if somebody's detoxing. I'm just talking about before you even go into the jail at this stage. But again, you're going to be sitting amongst a sea of people for many hours. And if you start detoxing and start experiencing, medical conditions, that's responsibility is either on you to go out and get somebody, which you may not be comfortable doing because you're afraid of legal repercussions, or hopefully to be identified by somebody to go back to what we were talking about with like the diversion facility, one of the challenges there is most people in that facility they're not trained to recognize detox symptoms, to be substance use specialists and counselors. So somebody could be detoxing and certainly easily missed because they don't have the training of it. I mean, I've been in that facility looking at people and
they're deputies,
right? Yeah. Most are, they're working in the criminal justice system. They're not trained for that. And unless you have the trained eye for that. So that's part of the process, is that through that elongated period when somebody's in there, they could start detoxing. To your point, other point too, is when you, depending on the ultimate disposition, you may very well be transferred to the main jail, meaning that if either you were given a bond that you can't pay, or a variety of other reasons that your processing is just taking too long, you need to be given a bed after a certain amount of hours. And so you can't just be, under state jail standards, you can't be told you're going to sit on this metal bench for 30 hours.
Right.
At some point, you're transferred into the jail, into a cell.
Yeah, I feel like it's 48 hours. I don't know, but anyway, but yeah, you can't be in. You have to have a bed at some point.
At some point, you have to have a bed, and so a number of people are often then transferred to the main jail, where they're, again, in more of a jail facility, or they may be in a cell with a bed, something of that nature. And as you're alluding to, this is where, unfortunately, there have been people who've passed away there and sometimes through detoxing.
Right. And even here, this is where it gets like, this is where I start to use the word crisis, because it's there's like layer, it's like the foundation's not right. And so everything that gets built on the foundation to me starts to be just slightly off, and it compounds and compounds and compounds. So then so there's no diversion center, and then people, some people go into the jail as inmates, right? And there you talked about how jails weren't designed to be like psychiatric hospitals, but that's, in many ways, that's what jails have become, not just ours, but all over, right? And I know from talking to the sheriff, like they don't have enough mental health beds. We've got a whole study from Meadows that says there aren't enough health beds. So it's like people end up, if they need, if they're at detox risk or they're actually at mental health risk, they may not actually end up in a jail setting that even then serves them. So I don't know if there's a question in that, but it's just, to me, each layer, it's like, because the foundation's off, everything else is slightly off for a lot of people who go in there.
Yeah. I think it's, as we've been discussing, right? Like you could see how there's a cascading process where one thing, on its own isn't, catastrophic, but it can lead to a domino effect of slightly more challenging conditions. And then all of a sudden, a person could be there for longer than they need to be, or they could be not optimally sorted, in a way, in a place where they need to be, or there might not be adequate staffing issues to catch an issue or deliver treatment to an issue. And you could lead to kind of an outcome like, unfortunately, a death, which everybody wants to avoid.
Yeah. No, I know. Everybody, as I've looked at the deaths in the jail, nobody's saying like this is, like nobody's happy about what's happening there. It's not like people are indifferent to that. It's more just like I won't get into my impressions, but I have come away from all the interviews I've done and I've thought, okay, like we can patch things up at the jail. We can, you can knock down a wall, as you said, but part of me just thinks it's broken, and that, what our civic leaders should be discussing is kind of a whole reimagining, which would be a state-of-the-art diversion center and a civilian psychiatric hospital, and then also a new jail. And it's not because I want to like lock people up, but like just build a new jail that recognizes that you're already at capacity. You're putting inmates in other counties. Your intake center is too small. The county's growing rapidly, and that you could be the most progressive prosecutor and have the most kind of like keep people out of jail reforms, and that by 2040, if we're 4 million people, all of this stuff is still going to be happening. So I just, what are your thoughts about that? Is that too, like, obviously we're talking billions of dollars, but we're also going to spend $1 billion on a basketball arena. So, is that pie in the sky, or is that a civic conversation that we should totally shy away from because it's not realistic?
Yeah,
that's not a research question. But you're a policy leader.
It's not the cost is I think one of the major barriers to it, and it's not cheap to build these facilities. And as I was saying before, again, like, build a jail is costly. The materials are very costly. You have to build very thick concrete, steel reinforced walls, and make sure escape risks are not there. So it comes with a price tag. But I think that one of the things that is clear is, like, again, I'm going to probably use stronger language, but there's suboptimal outcomes that are happening under the current system. And if you cannot, like, if you do not make a change, you're just going to rinse and repeat. You can't expect the outcomes to differ. And I think that there has been clear options identified on how to improve outcomes, especially for individuals who are the most vulnerable. Again, for people with severe mental health, substance use, intellectual developmental disability issues, jails were not built as a means to help them, and they can very rapidly worsen those issues because you're putting somebody in a very vulnerable mental or physical state into a very challenging physical condition. It is not easy, like, to spend time in jail, even if it is just a couple days. It is a very, very strenuous environment. And so a key path to making strides in reducing those issues is an investment in dedicated facilities with dedicated staff and experts who can help and deliver treatment. But it is something that really cannot happen with just patchwork, right? With just, let me add, 2 more staff members to the jail. It does really take something centralized, and often that comes with both a physical structure that we can say, we're going to take people out of the jail, we're going to put them into a facility that has been designed with treatment, with mental health, with substance use in mind. It's more of an environment that's more comfortable and less stressing. It has better monitoring of people. It has, and then it also comes with adequate staffing levels. It says it has now people who are trained to identify as these conditions worsen, deliver treatment. And I think that's the key to prevention, where you see that these things don't become a challenge. And the other thing I want to touch on, we talked about this, is it pie in the sky? But I will say, every other major county has done this to some capacity. Like, so I don't think it should be pie in the sky. It doesn't come cheap, unfortunately. It doesn't come without some political will and a lot of careful planning. But if Harris County, Dallas County, Tarrant County, and Travis County can all do it, I do not see any reason that Bexar County cannot do it also. And
their mortality rates are much lower than ours. So it's so I think that, in the end, that's a really important consideration folks can think about. So since this report came out, what has changed in response to it? And we'll just start with that.
Sure. So there have been a couple changes in response to it, and then there's also a couple of things that are, say, actively in the pipeline, where I think they take a lot more time in planning, and also have to go through some government bureaucracy of bidding and things of that nature. So some of the major changes is, one, they have made changes to enhance the mental health screening assessment processes. So one technical change is the contract of that change from, was previously done by the Center for Healthcare Services, which was local mental health authority. It's now being done by University Health System. So there's a organizational change component to that. And University Health System also handles the physical health assessments in the processing facility, they also oversee both physical and mental health in the main jail. So there's some potential benefits to that, which is, again, as we were talking about at the very early, sometimes that difficult coordination as people move from one agency to the next agency. Having that all with under University Health System has the potential to kind of streamline that, get everybody under a holistic picture, make sure that people aren't falling off the radar anywhere. As part of that process, they're also looking at just revamping and becoming more comprehensive with mental health, screenings and assessments. Not aware of changes that have been made, but I've been privy and in meetings where they're trying to look for ways to just be more comprehensive to that. So that's one major change, and is more or less consistent with recommendations that were in the report. I do want to touch on something that sounds like a minor change, but I was at the facility recently, and they have, as you're aware, there's TVs in the facility. They have recently put up a TV that gives people's names and indicates their bond notice status, which some people might sound like a minor thing, but like people put their mindset in somebody who's been sitting in a facility now on the 9th or 10th hour and has literally no idea if they've gotten bailed out, where they are, and there's no information dissemination. And so there are more attempts now to transmit information more clearly to people, to tell them, you've been bonded out. And I think that actually helps people in many ways mentally. It also helps the staff because it doesn't burden them by being peppered with questions all the time. Like, hey, what's happening with me? One other thing that just came to mind, they are kind of piloting a color-coded bracelet system too right now that to better help track people in the process. So the report kind of recommended investment in data systems and technology that can do that. In the financially, the more cheaper option is to try to do something. Again, it's manual, but there are some attempts in that. So those are smaller things. Some of the other larger recommendations that came out of the report, which I know are progressing but haven't been implemented. So one is movement toward an electronic bonding system is being looked at heavily. There's been some work with the IT department, as well as communication with outside organization, and some requests for proposals put out. That's beneficial because if you go to bail somebody out right now, it is literally paper-based. Like, it's paperwork that is filled out, is entered in a computer system. There's paperwork that is the transmission process, and you have to physically go to that facility to bail somebody out. So you could live on the opposite end of the county. Getting to downtown, depending on what time of day it is, can take quite a while. You have to find parking down there. Often you have to pay for parking. So if you're very low income or indigent, this could become a very costly financial thing. The electronic bonding system, which other places have implemented, even went up to San Marcos to witness theirs, allowed you to do that right from home, right? You got arrested, you need me to bail you out, go to a website, type in credit card information, hit send, done. You're done. You're bailed out. And so I think that actually helps people move through the process a lot quicker, helps with record keeping, helps with efficiency. And then the other big thing is the push for diversion center. So we're talking about, this is a big endeavor, but there is a lot of momentum that has grown behind this. So Councilmember Terry Castillo has recently put out formal call for this, formal request to start meeting with the city manager about this. I've met and talked with her office. They're working actively to form an ad hoc committee, both city and county representatives that can come together and to start pushing for this. Number of other organizations related to behavioral health, public health, mental health throughout the city and county have also taken interest in this, have come together, have started holding meetings, have started kind of doing some preliminary assessments about the feasibility of it, have started to identify existing structures in the city that are under that are owned by the county that could serve as a diversion facility. And so I think while, some of these things, big things, may seem pie in the sky, at a point, I think that there's momentum growing toward them. They do take some time to be implemented, but I think that there's potential there, and one of the things that is important is to keep that momentum moving forward and not have it, fall off, because this is not the first time a diversion center has been discussed here. It has come up before, and that momentum moved forward, and then it kind of stalled.
Yeah. Well, Dr. Testa, Alex Testa, thanks for being here. UT Public Health,
Yep.
UT Houston. UT Health Houston Public Health.
In San Antonio.
Sorry, in San Antonio. No, I appreciate you being here.
Thank you for having me.
Your insights are invaluable, so thank you so much.
Awesome. Appreciate it.